You mentioned seeing some of your patients as the forgotten.
Mm-hmm.
What does that mean?
I call them the forgotten. I don't know if they were ever seen.
I remember her getting to stand.
Yeah.
Seeing her walk at that time was really awesome.
Yeah, it was.
She'd almost get in trouble if she could actually move.
A lot of providers get their head wrapped around, solving this exciting case, and my patient that will now be able to drive, and my patient that can now get a formal education. And, Janiece doesn't fit that mold.
I'm Ashley Benecchi, a network news investigative journalist. And if there's one thing I've come to learn about stories, it's that each has two sides. In epilepsy, there's that of the provider in the office and that of the caregiver at home. But what I've also come to learn is that one side of the story can't be told without the other. Though both sides face separate challenges, the struggle is shared. But so is the success. Come with me to get the full experience.
We're Ria and Steve. We're high school sweethearts. We have two children, Michael and Janiece lives with LGS.
At what point did you realize that Janiece was having seizures?
Well, that didn't happen till 5, 6 years old.
Yeah. She had a really good school teacher, and Sarah knew what to look for, and she's the one that says, maybe you ought to take a look at this and see, and because we're seeing some signs. And so that's when we took Janiece to a
pediatric
neurologist and had her tested. And that's when the diagnosis came that she was having seizures. At the age of 23, Janiece moved to the care facility, and just like you find with your child going off to college, it was hard, but it was okay.
It was hard, yeah.
We were thinking last night and remembering the first time that we did meet Kelli. You walked in and you didn't even acknowledge Steve and I. You went right to Janiece.
And that definitely is a pet peeve that I have of people who, she can't talk, then we just ignore her. And I think that is so incredibly wrong. She's the star of the show.
Yeah.
You described a frustration when you took on Janiece's case.
Sure.
Why?
Because she was not properly diagnosed. She had a generalized epilepsy diagnosis. She was definitely a Lennox-Gastaut patient.
You'd go to a specialist to find out what's going on, and they would kind of tell you a little bit, but they wouldn't give you, okay, this is what's going on here.
Take me back to the first time you met Janiece. What was she like?
She was terrified. Gripping her wheelchair, wouldn't make eye contact, had just this grimace on her face and her jaws locked. I actually printed off several of her notes and, printed off from when we first started with her. Mm-hmm. And it was saying she won't look at me, she's very reserved, very rigid.
Before EPIDIOLEX. Normal day for Janiece would be waking up in the morning and the brain starting and having seizures right off, real hard seizures. She would get frustrated and then she would start biting. She would start biting her hand because she didn't know what to do.
One thing I find fascinating as you think about that diagnostic triad and her clearly to you being a Lennox-Gastaut Syndrome patient, you said that when you looked at her case, you didn't need new information.
No, it was all there. It was ripe for the picking. Just had to look at her and actually take a good history.
How important is the Refractory Epilepsy Screening Tool for patients with LGS and for their providers as they make a treatment decision?
It's a very useful tool. It's always been the cognitive delays, the early onset, the slow spike wave history when they're little. Sometimes we'll have patients that don't have the slow spike wave that hit everything else. And that REST tool at least does open up to a provider the possibility that it's not just about that EEG diagnostic.
How quickly did you choose to shift to EPIDIOLEX?
Pretty much as soon as Ria and Steve would let me. I just was hopeful.
How did you explain the risk-benefit approach to trying EPIDIOLEX to Ria and Steve?
As far as the risks, I'm going to monitor your liver enzymes. I'm going to monitor you for somnolence. We're going to change the other medication if we need to.
EPIDIOLEX has a flexible dosing schedule. that allows you to titrate up for your patients, which can be particularly helpful with side effects. Was that important to you as you thought about transitioning Janiece to EPIDIOLEX?
I mean, it's important, I think, for all patients. There is a dosing schedule, and it says, you start at this many milligrams per kilogram per day, and you go up, very systematically. But the provider really has a lot of leeway to kind of choose and let you be a little more holistic in your treatment approach.
What was it in the EPIDIOLEX clinical data that really landed for you and intrigued you?
The biggest thing was the data on 50% seizure reduction, 75% seizure reduction on patients that have literally tried everything else. The clinical data for EPIDIOLEX is supported in my everyday practice. She had tried several medications in the past, but she hadn't tried the ones that were right for her diagnosis. She's completely different. She actually has seizure-free days, which is not something I ever expected. She's not seizure-free. She still has seizures. They're less intense. They're less frequent. She doesn't stay post-ictal all day long.
After you started EPIDIOLEX for Janiece, she experienced significant seizure reduction. What did that seizure reduction do in terms of how she presented at your next visit?
It became very clear that the majority of the visits before, she was post-ictal. I mean, she was in a fog. So she would look around the office much more. She was interactive with her parents. You'd actually see her smile, which I'd never seen before. She wasn't gripping her wheelchair. So it was just an overall calmness to her.
She's got a sparkle in her eye, and she's got a smile on her face. And that was what's important to us.
Steve, you said Janiece talks with her eyes. Since EPIDIOLEX, how is that conversation different?
I see a more relaxed facial expressions rather than the kind of a tightness.
Tension.
Yeah, she's just more relaxed.
What would you share with your peers about the importance of those seemingly less clinical benefits?
Those are the most clinical benefits you're gonna ask a family member to identify. That's what they care about. They don't want to see their loved one having a seizure, but they want to see their loved one. They want to know who they are.
That's all we ever wanted, is let's just improve her day-to-day life, and she did it.
I hope my patients and family know how much I, stay up at night thinking about them.
I told you, and you told me earlier, that I'm proud of you because of how you do things, that you look at the person.
What would you say to your colleagues about these refractory patients?
LGS affects so many more patients than I think I realized. Patients deserve someone to care, for their provider to be interested and invested.
Important safety information and indications. Contraindication, hypersensitivity. EPIDIOLEX cannabidiol oral solution is contraindicated in patients with a history of hypersensitivity to cannabidiol or any ingredients in the product. Warnings and precautions. Hepatic injury. EPIDIOLEX can cause dose-related transaminase elevations. Concomitant use of valproate and elevated transaminase levels at baseline increase this risk. Obtain transaminase and bilirubin levels prior to starting treatment at 1, 3, and 6 months after initiation of treatment, and periodically thereafter or as clinically indicated. Resolution of transaminase elevations occurred with discontinuation of EPIDIOLEX, reduction of EPIDIOLEX, and or concomitant valproate, or without dose reduction. For patients with elevated transaminase levels, consider dose reduction or discontinuation of EPIDIOLEX or concomitant medications known to affect the liver, for example, valproate or clobazam. Dose adjustment and slower dose titration is recommended in patients with moderate or severe hepatic impairment. Consider not initiating EPIDIOLEX in patients with evidence of significant liver injury. There have been post-marketing reports of cholestatic or mixed patterns of liver injury. Elevated ammonia levels were reported in some patients with transaminase elevations, most taking concomitant valproate, clobazam, or both. Consider discontinuation or dose adjustment of valproate or clobazam if ammonia is elevated. Somnolence and sedation. EPIDIOLEX can cause somnolence and sedation that generally occurs early in treatment and may diminish over time. These effects occur more commonly in patients using clobazam and may be potentiated by other CNS depressants. Suicidal behavior and ideation. Anti-epileptic drugs, AEDs, including EPIDIOLEX, increase the risk of suicidal thoughts or behavior. Inform patients, caregivers, and families of the risk, and advise them to monitor and report any signs of depression, suicidal thoughts, or behavior, or unusual changes in mood or behavior. If these symptoms occur, consider if they are related to the AED or the underlying illness. Withdrawal of anti-epileptic drugs. As with most AEDs, EPIDIOLEX should generally be withdrawn gradually because of the risk of increased seizure frequency and status epilepticus. Adverse reactions. The most common adverse reactions in patients receiving EPIDIOLEX, greater than or equal to 10% and greater than placebo, include transaminase elevations, somnolence, decreased appetite, diarrhea, pyrexia, vomiting, fatigue, malaise, and asthenia, rash, insomnia, sleep disorder, and poor quality sleep, and infections. Hematologic abnormalities were also observed. Pregnancy. EPIDIOLEX should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Encourage women who are taking EPIDIOLEX during pregnancy to enroll in the EPIDIOLEX Pregnancy Surveillance Program and the North American Anti-Epileptic Drug NAAED Pregnancy Registry. Drug interactions. Strong inducers of CYP3A4 and CYP2C19 may affect EPIDIOLEX exposure. EPIDIOLEX may affect exposure to CYP2C19 substrates, for example, clobazam, diazepam, stiripentol. Orally administered PGP substrates or other substrates, see full prescribing information. Consider dose reduction of orally administered everolimus with appropriate therapeutic drug monitoring when everolimus is combined with EPIDIOLEX. A lower starting dose of everolimus is recommended when added to EPIDIOLEX therapy. Concomitant use of EPIDIOLEX and valproate increases the incidence of liver enzyme elevations. Pneumonia was observed more frequently with concomitant use of EPIDIOLEX and clobazam. Dosage adjustment of EPIDIOLEX or other concomitant medications may be necessary. Indications. EPIDIOLEX cannabidiol oral solution is indicated for the treatment of seizures associated with Lennox-Gastaut Syndrome, LGS, Dravet Syndrome, DS, or tuberous sclerosis complex, TSC, in patients 1 year of age and older. Please read the EPIDIOLEX full prescribing information for additional important information.